Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. Today we're going to talk about buccal fat pad, chin augmentation, implant, and really kind of this lower third of the face augmentation, if you will. You know, this has become super hot over the Zoom era, if you will. But even before then, I think that's an area that people just wanted to look better, but maybe didn't know how to get to that point. And so we got our master injector here. We got Dr. Weinfeld, our facial specialist, to help us. And then if we need some anesthesia, celebrities here. And then Donald's still recovering from his birthday shenanigans. So we'll hear what's going on. But before we jump knee deep, let's go through our cast here and see what's going on. Tall Gamer, what's new with you?
Yeah, man. Just dealing with the crazy Austin weather, like these, I'm getting some PTSD, if you will, from the low temperatures. And oddly enough, it killed my community garden plot.
Okay.
So not so happy about that. Literally misread the forecast and went there the next day. Everything was yellow.
So you should have put a thermal blanket over it. Okay.
Yeah.
Not such a green thumb there, huh?
No. I'm brown.
Just
like the plants.
Dr. Weinfeld, what's going on with you?
Yeah, it's interesting you should mention the weather. I like this time of year. I like this type of weather. I grew up in Maryland, where we had 4 seasons, and I always enjoyed the winter. So I like it when it's cooler here. Kind of like I feel invigorated, more awake. And also my eyes are so fair and I'm so sensitive to light. I kind of like when it's a little bit overcast. I mean, I'm not a melancholy kind of person, but I don't mind it when it's like that sometimes. So
But it tried to kill us last year.
That's true. Yeah. Yeah. So I think I must live next to someone on the ERCOT board because we only lost our power for 1 day. And my heart goes out to all of the people. Yeah. Obviously, it's a very serious topic and caused a lot of damage, even death. But we kind of came through it relatively unscathed. Yeah. So we're fortunate for that.
G-berto, what about you?
I don't mind the weather.
Oh, okay. Just so people know, I didn't know this was a weather podcast, but we're going to share our thoughts with this.
No, my boy David Yeomans. Get him on.
Breast, butt, and weather.
I'm just joking. Actually, I'm doing well. Loving life. Love working at Austin Plastic Surgeon. I can't keep plugging it enough just because I'm so happy.
And how's your puppy doing?
She's good.
Yeah,
she's getting big.
Have you let her out of the crate since you had her or no?
No, she's still in the crate.
Okay,
yeah, they said crate trained.
Yeah.
So
yeah.
What's her name? What's her name again?
Her name's Riley.
Riley?
Yeah.
That's a good name.
I thought there was a full name. There was a different name.
Riley? No.
I guess
so there
Riley
was
Signs?
Riley Signs.
Yeah.
There was so I did have a poll trying to get people's opinions on what I should name my dog, and I think what Donald is referring to is at one time I wanted to name her Ryder Diane, so that she could be my ride or die.
Yeah.
Boom.
Like
Strong name.
like
Strong name.
T-Bone, what about you? What's going on in the celebrity world?
Oh man, well, celebrity wife. She started her business, Your Dementia Therapist. Check her out. Her website is yourdementiatherapist.com. She started she's now a resource and a consultant for families, helping them navigate the difficult waters of dementia care for a loved one. And it's been super cool to see her grow this business and just developing everything that goes along with it. So that's been really neat. That's kind of been the big thing at our house lately. Every night is now like a business meeting over dinner between our stuff that we've got going on with celebrity anesthesia and then her stuff with her business. It's been a lot, but it's been fun.
It's interesting how the world's evolved in this, basically demand care or demand resources in terms of some of these other things. So that's super cool.
And it's been a neat thing that's kind of, been born out of the COVID crisis and a lot of great businesses have. So she sees patients on a telehealth or from a telehealth perspective, and then she does some in-home or at-home screenings and stuff too. So really neat. Super happy for her. She's crushing it.
Well, speaking of telehealth, let's talk about, the lower face, because that's a lot of the part that really gets people, a little bit anxious sometimes when they're seeing themselves. And I think, we don't recognize some of these stuff until we see it on camera. And, lips, Botox, those type of things seem to get all the hype. But there's some big changes that can happen. And so, Gilbert, Dr. Weinfeld, one of you guys want to maybe talk about buccal fat pad? I know we've talked about it way back when, but if somebody, 1 or 2 people in the world missed the podcast, maybe let them know what that is and what it does, and then we'll kind of work through some of this.
Dr. Weinfeld, would you like to see this?
Sure. Yeah. The buccal fat pad is a segment of fat in the deeper portion of the face in the central cheek. It is something that plastic surgeons have taken to modify recently, really by removing a portion of it in order to give a little bit of a hollow, a little bit of sort of a puckered lip look rather to the central cheek. And the nice thing about that is it can make someone look thinner, look as a less heavy, but it also highlights some of the prominences in the face that can give a really distinct, very attractive look. And so if you're creating a little bit of valley in the central cheek, what it can highlight is the upper cheekbone or the malar eminence. It can also highlight the gonial angle or the angle of the jaw. And then also to the front of the jaw, we have the chin, and it can highlight that as well, really by subtracting in the valley between those three structures. And so I think it's a wonderful procedure. I do it pretty frequently, especially on my FFS patients, so facial feminization, trans female patients, because it can really enhance the femininity by decreasing some of the volume in the lower face relative to that kind of increasing some of the volume in the upper part of the face. Very wonderful procedure.
I've seen some people who get nervous about this because they think that it's going to be this major change to the face, or they're going to have a ton of loose skin after removing this. But it's more of a subtle change. People do see a difference, but it's not like this a 40-pound weight loss type.
Yeah. I mean, I would say, if anything, some patients wish they could look as if more was removed. So I would say it's pretty subtle. Another thing too is I think that the fear of it creating laxity in the skin is probably not a reasonable one, because that skin is still tented up by the cheekbone above, a very firm supportive structure, the jaw, and the jaw as well. Also, there are muscles within the face that are still both in a dynamic way and even a static way supporting the skin, because you're really taking the fat out between those muscles. So I think it's a reasonable thing to think about. And I guess I would never want to discourage a patient from having those concerns because they could be realized, but I have not seen that to be something that frequently occurs. Not to mention the fact that we're not usually doing this procedure, at least I'm not usually doing this procedure in isolation. Like I said, in FFS patients, I'm doing it often with the combination of adding some fat or some volume to the upper cheek, the malar region, again, through the process of fat grafting, segue into the chin implant. Often we're also placing a chin implant, which gives a little bit more structure to the jaw. I think the fact that it doesn't do as much as people expect it to in terms of creating laxative skin, and then also some of the counter maneuvers that go along with it, it's really not something that we see.
One of the cool things about buccal fat pad removals that I thought was interesting several years ago, is learning about this procedure and doing it more common now, is that the buccal fat pad is actually pretty consistent from person to person, because this is a little bit different than like the fat that we lipo in our tummy or love handles. This is a specific fat pad that from one person to the other is actually pretty consistent. From males to females can be very, very consistent. And so when we take it out, it's I guess there's a little bit degree to how much you can or can't hang out, but typically comes out as one nice little fat pad that's very consistent, and that's part of the safety of doing the procedure done correctly. Because as Dr. Weinfeld alluded to here, it is sandwiched between some muscles. There's also a lot of important nerves, arteries that run in that very same area. So the scar can be hidden very discreetly inside the mouth, and when you go back 6 months later, it's really hard to.
No, it's invisible. Yeah.
To ever find. But you do have to do, it's a tiny little incision, something that you can't find, but there's a few techniques that make it, in terms of safety for that area, because of the important structures and the uniqueness of the discrete nugget, which I always think is so cool and interesting.
Well, I think, No, I was just going to say, we mentioned that it's a subtle change, but one thing that is really cool about it is it's an instant gratification kind of procedure. I mean, that little nugget comes out, and like, they've got that nice subtle little tapering of the cheeks. It's a cool deal.
Yeah.
Especially in men.
Oh, yeah.
I had tried to push a few men around because I felt like their face was really round. I didn't think it was going to make that much of a difference. And I have a round face too. And it was interesting. It wasn't like, and it's one of those things almost like surgery of like the lower eyelids where you take out the fat pads, where people are like, oh, there's something different about you. Did you lose weight? Did you change your hairstyle? Something. Most of the time people can't point it out, but they're like, you look better. And they don't even know, which I think is really cool. And typically a sign of well-done plastic surgery when people are like, you look good, but I don't know what you did.
Oh yeah, absolutely.
There's a, I know we've addressed it before on the podcast about like targeted exercise and like, oh, I'm going to remove this piece of fat with this particular exercise and things of that nature. But have you guys seen there is a jaw cheek exercise thing that you're like, essentially you're just biting on repeatedly, and it's supposed to slim down this area, the lower thirds. And like, have you ever seen that, or have you?
I don't think it does what it's intended to do.
I figured it wouldn't.
What it does is it hypertrophies the masseter muscle, which is the muscle you use to chew. So in essence, it makes you look wider than what you really are.
And something we've talked about in the past is actually treating those masseters.
Yeah.
People have very thick ones that can sometimes, we're trying to get that inverted, that V shape for the face, and they can actually make you look a little bit boxier. So,
and even for men, I think it's not a great idea because, even as men, we want to have a boxier look, more chiseled jawline. But I think from what I've seen, what I've read, that device itself just makes you look really wide and doesn't have the appropriate proportions to the face.
And so as we discussed, the buccal fat pad doesn't change with our weight and so forth, or the muscles aren't going to affect this because it's a set size. And there was actually a unique study that actually looked at 30 consecutive patients, and those fat pads didn't vary very much from person to person, regardless of their BMI, height, weight, or gender. So it's super, super interesting.
I wasn't aware of that, although now that I think about my experience with patients, you're right, there is very little variation in the amount of fat that you remove. And I think you had a good plug for safety. Clearly for someone a plastic surgeon who is starting off in this field, you don't want to really kind of dig deep and try to find more than you can actually safely remove. I think it's really important to make that incision near that second molar, make sure you're avoiding the parotid duct. And then you do need to separate that. You need to free a little of the fat, but you want to, once you kind of tease it out, you just want to remove, you just want to kind of essentially amputate it at the level of the mucosa and not try to fish more out or, dig your bovie in to cut fat out from deep, because you like you said, the facial nerve, or the nerve that helps us smile and gives us animation and our expressions, you can injure that if you're not careful. But if you follow the simple rule of not digging, I think it's a very safe operation.
It's funny because it's one of those that, it's just a little bit of patience, a little bit of time, because it basically comes to you. You just take out whatever comes to you. Whatever doesn't come to you, you just got to leave it behind.
It's super gratifying. Yeah. Have you ever done one under local? I have not yet.
I have not. I definitely think it's something that you could get done. I think some of it has to just do with some patients tolerate people being on top of their face a little bit more because it is in their mouth and our hands are over their face. I think in the right person you could, or even a little bit of Pronox stuff. I personally, sort of like you, have done this most commonly in combination with other procedures. And sometimes it's in the face, but sometimes it's even someone who had body lipo or breast dog, and again, someone who's thin and just had a little bit more of a round face and wanted to tweak that too. So I haven't done as many as just a pure isolated function, and maybe get into combination stuff if you guys don't mind kind of working in, because the whole goal is to give people that nice shape to their face. And we've talked about it with facelifts and other procedures, that the old adage of just doing a single treatment typically doesn't get people where they want.
Yeah.
And so some of the things that we talk about is chin augmentation, and maybe we can talk a little bit about chin implants, Dr. Weinfeld, and then Gilbert can talk about, filler, because it kind of depends. Not everybody's the same, but when we evaluate somebody and they come in for buccal fat pad removal, I think all of us are pretty good about, let me just take a look at all of you, and we'll turn their face different ways, because it may not get them the result they want, even though the treatment itself or surgery itself was successful.
Yeah. I think that that the cheek is an area in which what you're talking about is as true, if not more true, than other regions of the face, where it's really trying to achieve harmony. And I like to think about it as the MGG triangle. So we have the malar eminence, the gonial angle, and then the chin, or the genial, aspect of the jawline. And I think that a face looks really nice when both men and women, when it's kind of close to an equilateral triangle, and where you do actually see a small prominence in each one of those locations, with that central cheek, both in men and women, kind of having a little bit of a dip, a little bit of a puckered look in between that. And so, yes, when you start to see a patient, you do need to start to think about the other features of the face that are contributing, let's say, to the look of the cheek. And it's kind of a delicate conversation to have with patients, because I know you're like this too. I don't want to be the surgeon who's trying to upsell patients. But you do have to introduce the idea of that there's, these different subunits of the cheek, and they all work together, including the chin, that all kind of work together to create that harmonized, that balanced appearance.
And it's nice when people bring pictures and what they're hoping to achieve, because then it gives me an opportunity to explain, hey, I see what you're saying and why you like this picture. But if you notice in this picture, it's not just the cheeks itself. Then it comes out to a point, you see this jawline. And, while I can take that buccal fat pad, if there's nowhere for it to go, you may not still have that right angle neck. You're still going to see that chin recessed.
And I think a lot of patients too, they see something they like in a person, celebrity, friend, whatever, but they can't put their finger on why they like that. And what you guys are, if they've got a strong, jaw angle, or they've got a strong jaw, that's going to look, completely different on somebody that has, very recessed chin, but doesn't have any, fat or volume in their cheek, right?
I think we're headed toward talking about the chin. You brought it up. Yeah. And we were, we don't want to treat it like the redheaded stepchild. Let's, before we talk about surgery, why don't we, the chin's really important, and there's a lot of things that can be done with fillers. I'd like to hear your experience on augmenting the chin with fillers if you haven't. I imagine you definitely do.
I think it's very important to, as we have spoken about, get a good feel for what the patient is trying to achieve. Obviously, that's our number one goal, is to try to give them the best outcome possible. But I think that there are variables that we have to take into consideration, male versus female, for example. A male chin is very different from a female chin. We don't want to create a sharp point on a male chin and feminize them if that's not what they're trying to achieve, and vice versa. We don't want to widen a female's chin unless that's what they're trying to achieve. And so I think knowing anatomy, knowing facial ratios for what's appropriate for a man versus a woman is super important. That's why I think it's really important for patients to consider that when they're choosing who their injector or surgeon is, because there's a lot that goes into that, and studying the facial anatomy and what are appropriate proportions for both sexes. So I think that's an important point.
What filler have you had the most success with in the chin and the jawline?
So when I'm injecting chin, I'm usually using something that is a little bit thicker, a little bit more robust, so we can get that lift or that projection that we're trying to do. To name specific products, I like Restylane Lift. I like Juvederm Voluma. They tend to have a little bit more robustness to them, a little bit more lifting capabilities. So those are the ones that I've had probably the most success with.
How long could I expect my result to be?
So the good thing about the chin, or injecting the chin, is that, there is some muscle movement there, but it's not like muscle movement around the nasolabial folds or around the marionette lines where there's all these different muscles, moving in conjunction with one another. So you can get longer lasting effects. I usually tell patients between 9 to 12 months is a pretty safe estimate. But
depends on the specific filler.
Depends on the filler, and there are some that actually last a little bit longer. Voluma, for example, has the lifespan of up to 2 years.
Oh, wow.
And so, you can get, anywhere between 15 to 24 months on some of these. But I always try to give them realistic expectations, so that if in case it doesn't last as long, they know that was something that was kind of already discussed.
And how much product would you say on average do you think you need?
I think it depends.
That's a good question because I think sometimes people come in and say, "Oh, I just want one syringe for my chin, my jawline, my cheeks, and maybe just tweak my nose."
Yeah.
they don't have them come in 60 cc tube syringes yet, do they?
No, they don't.
Yeah, that's tough. I mean, it's case by case. On average, and you know, again, these are not definitive volumes by any stretch of the imagination, but on average, anywhere between 1 to 2 syringes for the chin is I think pretty acceptable.
Yeah.
But and just so we're clear, we're talking about just the chin, because if you throw in the entire jawline going from the angle of the jaw to the chin and back around,
That's a lot of real estate.
that's a lot of area to cover. And so, I mean, I always tell people if I'm doing jaw, not even trying to really get their chin out, at least 2 syringes and that they're going to be back. And so I just don't want people to misunderstand what you're saying. When you're saying 1 or 2, you're just talking about a chin augmentation. If you're trying to do the whole wraparound, I mean, you're going to need several syringes, and may not do it all in one setting, but just trying to be clear that you're not disappointed during this journey.
You know, here's another way to think about this, just in terms of thinking about volumes. You know, so I will, in some patients in whom I'm doing a facelift, I will augment the chin and the jawline with fat. It's not a perfect, you know, comparison to filler, but, you know, these are older women who might have had a small jaw to begin with, or have developed a little bit of bony or even muscular atrophy over it. And they just benefit from a little bit more of a distinct jaw and chin line. You know, it's something that, you know, we're all familiar with how aesthetically beneficial that can be. And so, you know, I'm often doing fat grafting elsewhere in the face. That's really a really important part of a modern facelift. And that's one area that benefits too. And I will say that in these patients, I am injecting, you know, 3 to 4 cc's in the chin sometimes, in the pre-jaw area, 2 to 3 cc's. And then I have a very nice long cannula that I can either enter at the front part of the jaw or even sometimes posteriorly. And I sometimes will put, you know, between 6 and 9 cc's of fat along the body and the gonal angle of the mandible without making a female patient looking too masculine. So that's a lot of volume. Now, slightly different patient potentially, because I'm talking about an older patient, you know, but it does speak to the fact that you can actually require a lot of volume to make a meaningful difference.
And for those who are not familiar, I mean, a majority of these syringes of filler come in 1 cc volumes. And so when you're talking about 6, 9 cc's of fat, it's a cc is a cc, regardless of whether it's fat or hyaluronic acid. You're talking about the equivalent of like 6 to 9 syringes of filler. You know, compared to what.
And remember, you do lose some fat, you know, and then depending on the product, it's a little bit different stuff. But I think the point is that you need more volume than you think. And sometimes a lot of people are doing fillers too, because if they had a lot of laxity, if I think and it'd be interesting who you would refer for a chin implant or surgery. I think if you needed 10 or 12 syringes, you probably would refer them for a surgery if they had that much volume. And some people do. Some people do need a much further augmentation.
And this is not a conversation to discourage patients in any way from having filler to address chin. I think it's a wonderful thing to do for a variety of reasons, and that, you know, to borrow some terminology that we used in another episode, but it does allow a patient to date the process of, well, what would my chin look like if it were bigger? Also, especially in the short run, but even over the midterm, it's less expensive because it doesn't require going to sleep. Sorry, celebrity anesthesia. It doesn't require
you
going
guys
to
are
sleep.
killing me.
And you know, you don't have to pay for a chin implant either. And I, you know, and also when we're implanting something, and now I'm not trying to talk people out of chin implants either, but there are complications associated with this. So, you know, it's really, you know, as you've always hammered home, it's all about speaking to the patient, really trying to get inside of their head and helping them get inside of your head and understand what is going to be best for them. And that's part of the fun of what we do, right? I mean, it's like a puzzle.
Right.
We got to mute his mic. He's talking everybody out of it.
But in the
I'm chasing people from one direction to the other and the other direction. In net, people are still getting procedures.
But in the right person, those chin augmentations and jawline, they look so good. I mean, people look, you know, 20 pounds lighter. It just gives a little bit of that angle. And that's some of the art that's absolutely fabulous. I have a lot of men that like the chin augmentation, and there's someone like, look, I get it. You know, would this be easier? Just get a chin implant and be done. I just don't want to do surgery. I like coming in. I'll come see you every year and a half, you know, and get my 2 syringes on my chin. And
Yeah.
I'm
Yeah.
cool. I know
Have you-
you've given me the option.
Have y'all seen over the last 2 years in particular? Have you seen less chin augmentation and cheek buckle fat pad just because like everybody's masked up? Like,
No,
no.
the exact opposite.
Yeah.
They're doing more.
Okay.
Not even,
think
not even
more.
close.
Yeah.
Yeah.
Yeah, because they're still very much face forward when they're doing, virtual interaction with
Zoom or
patients.
FaceTime.
If anything,
Yeah.
more so. Yeah.
Okay.
Yeah.
And with the mask, they can hide, any bruising or anything that maybe is sequelae in the immediate post-procedure timeline that they can hide from the public.
And
Oh, so
definitely-
now's
I
the
definitely
time.
see more men because I think as men, we just probably don't judge ourselves as much like in front of the mirror when we're brushing our teeth, shaving, doing those type of things. But I'll tell you, if you're sitting for an hour on a Zoom call looking
Yeah.
at yourself, after a little while, you start to be like,
You start to care about things that you didn't.
what's going on here? Like I never really noticed this,
Yeah.
so,
when did I get that third chin?
100% this is coming.
Yeah.
I guess my question to both of you is, how do you decide when somebody goes from, filler to chin implant? What pushes you in one direction versus the other? And I know some of it is patient, and having the discussion, but
Mhm.
but when would you talk about that?
Outside of like any kind of congenital type stuff that would require more of like a surgical approach, you mean? Or,
Yeah,
or
just
including
well,
that population too.
Well, I mean,
that's pretty
I think
straightforward, I
if they're congenital, something that's really drastic. I mean, I think that's something that's a
Yeah.
different category. But just the average person that walks in and says, "Hey, what should I do?"
For me, I guess if it's something that I feel, although it can be achieved with filler, is going to require a lot of filler, and the patient may be price conscious because it's obviously not going to last forever, and they might be better off getting something that's more long term or permanent, so to speak.
Yeah. And I don't have an answer for your question. The reason why is that the context in which the idea of modifying the chin comes up is a little bit different than I think Gilbert sees. I'm almost always discussing modification of the chin as part of more of a pan facial modification, so they're doing a chin implant in combination with a rhinoplasty, or they're doing a chin implant in combination with a facelift, or a chin implant in combination with liposuction of the neck, something that you had commented on. And so, or they don't know exactly what they don't like about their jawline or their neck, let's say. And to me, it becomes apparent that the problem is they either have a small chin or a chin that's retro displaced, further back, and it's not really pulling that skin out the way that it should in the neck, and so that their neck looks, larger, fuller than it would otherwise be if they had more of a structure to their chin. And so for me, when I'm starting to see a patient in that context and we're talking about surgery anyway, for me, it's usually a discussion of, fat grafting versus a chin implant. So fat grafting the chin versus a chin implant. Fat grafting can get you just a little bit of an augmentation. There are some limitations to it, even with the 3 to 4 cc's injection. Whereas a chin implant, and a slightly unpredictable, whereas a chin implant, and the fat grafting is relatively inexpensive, whereas the chin implant a little bit more expensive, but a little bit more predictable, a little bit more of a profound improvement in the size. So for me, it's kind of discussing in the context of a patient who's already decided having surgery, do they want to then make some changes in the chin, and then what of the two surgical techniques do they use? I will say that many patients opt for the chin implant because of the permanent nature of it and the fact that they can get a little bit more of a precise and predictable augmentation. A little bit of a discussion about technique, I think, I know that patients nowadays love this.
One of the things on that last point to wrap up that section is, our service have been really good because in terms of there'll be people who they've treated for, year or two with filler doing stuff. And then the patient will be coming in for a surgery, breast dog, something. And they'll bring it up to them, because like, hey, we do your filler every 6 to 9 months. You're having a surgery with Franco or Weinfeld. Make sure, if this is something you'd be interested in, talk to them about a chin implant so you don't have, and it doesn't, and again, and I don't think either of us is saying that, hey, you'll never need jawline or chin filler again if you get a chin implant, because I don't think that's true. People keep aging and stuff keeps changing, but this takes the lion's share of that out.
Yeah. Oh, it can reduce the cost. In some ways.
Just kind of of another neat little niche, if you have a comprehensive team where everybody's trying to help you get to a good spot. And I thought that's pretty thoughtful of them to give up a patient, but do what's best for them.
Well, I mean, I think that's one of the benefits of our all of our mutual, our plural goal of just making a patient happy is that, none of us feel territorial about the patients that we're interacting with. And I think that's why we have so many happy patients.
I think, but we should circle to technique, and then even how chin implants have changed in options. Because when I was a resident, they had the little button ones, and now they've changed to a more anatomical, and then a couple different ways to put the implant.
Yeah. So first of all, what is a chin implant? It's something that is not a human material that we're putting against the bone in the chin in order to create some more volume and push the soft tissues out so it looks like the chin is bigger and more pushed more forwards, restoring some facial balance in the lower third of the face. And there are two types, or at least there's two main types. There's a silicone implant and there's a porous polyethylene implant. We're all familiar with silicone. It's sort of a translucent material. It's a soft, flexible material. The companies that manufacture these, they make them. They're a little bit more firm, of course, than the implants that we're using for breast augmentation, but they're a little bit more similar to the ones that are used for buttock implants. They're shaped like a chin that you put on top of the chin. I actually don't have any experience with silicone implants in chin augmentation, except for one instance in which I had to remove it, which is not to badmouth it, but I just don't have experience with it. And I think it had a little bit to do with my exposure and training, but also conceptually, again, there's nothing wrong with it. And I don't have enough experience to say, but conceptually, one of the things that I didn't necessarily like about the idea of it is that just like we can get capsular contracture of the breast, you can get capsular contracture of the soft tissues around a silicone chin implant, which can distort those soft tissues just as they do in a breast augmentation, and can end up with an unintended and unattractive result. And that was actually the one instance in which I removed it. So again, based on experience and also that sort of conceptual hang up that I had with silicone implants, I gravitated more to the porous polyethylene implants. So porous polyethylene, the way I explain it to patients, is that it's like a firm plastic sponge. It has these open cells or these little holes or pores. And the nice thing about that is that the soft tissues of the chin that it goes underneath can kind of anchor to it, just the way that those soft tissues are anchored to the bone. So it actually really provides support to the soft tissues of the chin. And it also, you essentially can't get a capsular contracture from it as well, because those soft tissues are just anchored to the implant. Also, the way that a body responds to porous polyethylene and open cell structure is a little bit different than it would to the smooth structure of a silicone implant. Both of those implants can be carved. Again, I have no experience carving a silicone implant, but the porous polyethylene implant, you can really modify and customize the profile of it and the size of it so that it fits well with the patient's anatomy.
And there's much more options in terms of ordering size
There really
stuff
are.
than there was even 10 years ago. And it's always funny how our training experiences shape us, because I've only used silicone implants and haven't used the others, and it's what I did in my training. It's what I felt comfortable with, because and you may get to this. I go underneath the chin
Likewise.
and make a little incision, and for some of the opposite reasons, I like it because I can make a small incision, tunnel a very thin tunnel underneath the periosteum, the covering of the bone, and slide that in. There's a couple little tricks to pull it out, because I think the chin implants have gotten a lot better, because some people I think didn't like them because in the old days they had some very square porous stuff, and as Dr. Weinfeld referred to, now they can actually help fill some of the jowls. It's more than just the tip of the chin that they can shape. It's really kind of that anterior third that they shape and help, which pulls the neck and really creates a better shape overall.
I've actually never used one of those. I mean, the brand that I use, there's a whole portfolio, and some of them are those little chin cap implants. I've never used one.
Me either.
And I'm sure there are instances in which they're helpful, but as you alluded to, the chin implants nowadays really respect the fact that you are often needing to augment not just the chin in an anterior posterior dimension, but also sometimes in terms of the width, and that it almost always makes sense to have little extensions off to the side that trail along the interior body of the mandible, you know, the anterior third or so, and really taper so it doesn't look like there's this little tiny, you know, sort of protrusion at the end of the chin, a little too narrow.
That's exactly why Gilbert uses more than one syringe when he's augmenting your chin, because he's not going to do that same thing to you and just give you one big bulge right at the very tip. He's going to do that same feathering with the product.
You guys have talked about like all these different technologies. Like I've never heard of the porous material before. For some reason, I got in my head that like you can't put a porous material in the body, but obviously that's not the case. What with all of these different technologies and pieces that you can do in there, who are good candidates for this type of stuff? Like, are there people that may not be a candidate for chin augmentation, or like?
I mean, I think it would be basically what you would do, like we've referred to. Most of this is people who are doing kind of multiple surgery stuff. So I mean, it would be, are you in good health? Can you undergo a surgery? I mean, I think that's the biggest stuff. And then is this reaching the goals? So I think those are the biggest things, other than you know, reactions to either one of these products is extraordinarily rare. I'm not going to say that nobody will ever, but it's extraordinarily rare.
Yeah. I do the way you do it, whereas I make a submental incision. And the reason I like to make the submental incision instead of going through the mouth, and this is headed towards answering your question, is that twofold. One is we're not going through the mouth with the added bacteria of going through the mouth, and we're also not. We're also in fact actually supporting the tissues of the chin, because it's as if you're pushing up the soft tissues, whereas if you go through the mouth, one, you have to cut through muscles that then you have to repair and have the potential to not heal well, but in some ways you're kind of decreasing the support of the lower lip, and you can actually have the lip and the chin slide down, you know. So I go through the submental region probably for the same reasons you do, but to answer your question, I think that one contraindication, even if we're going submental, might be someone who has really, really poor dental hygiene, a lot of caries, or cavities. Yeah. And in a patient like that, you have to wonder if they might be at a higher risk for an infection. So that might be something that would give me pause. That might be something that would give me pause. Yeah. Another thing is if someone has a really short mandible, you know, like a really atrophic mandible. And again, something that I would think about and I would get an x-ray on, because I usually don't get x-rays actually. I don't know that it really adds to anything, but if they have a really short mandible, you might be a little bit concerned about where the mental nerve comes out, and if there's even going to be enough space to put an implant there without it having impact or sort of squeezing on the nerve, creating numbness.
It's such a good point about the dentition. I don't think most people realize your dentition actually affects the strength, structure, thickness of your jaw, and a discussion for another day in terms of the mandible and strength and fractures and other issues down the road. But I think that's so cool how, and maybe we can circle back how this all comes together, right? So the buccal fat pad, you know, thins that lower third of the cheek, the mid to lower third of the cheek, and then you can use the jawline chin implant to give that a nice thing. And we haven't even touched on the bottom half of if you did a little skin tightening, whether it's J-plasma or Nuvion, all therapy, RF microneedling, lipo, to just pull that skin up. And when you start doing buccal fat pad chin, like, and all of those, I mean, for us, I mean, what do you think it would take you in a surgery to do buccal? Because it sounds like a lot to be a buccal fat pad, chin augmentation, and like neck lipo.
Yeah. So I guess what you mean is time wise. Yeah. Buccal fat pad, about 30 minutes, especially if it's combined with something that's already asleep. Chin augmentation, I usually give an hour for that. It doesn't always take that long. One of the frustrations can be a little bit, and sometimes when it takes a little bit longer, is really getting that implant in a very symmetric location. And with a porous polyethylene implant, I'm screwing it into the bone so it doesn't move. And that can sometimes have to put a screw in, take it out, put it in. But let's say about an hour. So now we're at an hour and a half. Neck lipo, I think it's good to allot an hour. You may not use it if it's only neck lipo, but then if you're going to add the Renuvion, at least another half an hour, maybe even an hour. So you're kind of looking at all of that together somewhere in the 2.5 to 3.5 hour time frame. Did I do the math right? Pay attention.
But in my point was just in 2.5, 3 hours, and it's actually a big change that can happen for people.
Yeah. Well, let's think about the clinical context for this. This is the patient like in their 30s. sort of mid to late 30s or early 40s who's like, I want a facelift, I want a neck lift. And we know that there are some patients in their young 40s that could benefit from a facelift. Some of them really need it, and it's the only thing. But I think sometimes patients come in thinking that that's what they need, where in reality, a combination of some soft touches, the buccal fat pad reduction, creating more structure to the jawline, whether it be with fillers or an implant, neck lipo to reveal some of the natural anatomy of the neck is really what they're asking for, even though they don't know the name for it.
100%. And it's because even with doing a neck lift or tighten this, if you don't address some of these other things, they can still be a little frustrated afterwards. There's no more skin left for you to pull, but they're still don't have that right angle because they're so recessed. It's hard to create the look they're going for.
Yeah.
With the when we were earlier talking about going in through the mouth for some of these particular surgeries, is there, because you're like for the buccal fat pad removal, you're cutting on the inside of the cheek, is there a different recovery process? Like, can you eat, or do you have to like go on like liquid foods, or what does that recovery look like for that kind of a surgery?
So I think there's a couple of things there because people are probably like, well, why will you go through the mouth for the buccal fat pad removal, but you won't do it for the chin implant? And that's a great question. For me personally, and don't get me wrong, when I used to do facial fractures, we go through the mouth all the time, and we put implants.
Totally different scenario.
Definitely a different scenario. So I'm not saying that that's not a appropriate technique in the right area, because it definitely is. For some of these cosmetic implants where you want the infection rate and stuff to be as low as possible, for me, it just makes more sense. And Dr. Weinfeld referred to some of this with the implant. But the buccal fat pad, we're not putting any implants in. I knock on wood, I've never seen an infection from a buccal fat pad, because like you said, we're making a tiny little incision and we're just letting this fat pad come to us, and then we close it. Most of my patients, I have them stay away from anything too hard, spicy, mostly out of a comfort level. But I mean, after a couple of days, they can eat whatever they want.
In healthy individuals in which you're not adding an implant, getting a facial infection from surgery is very, very rare. Sometimes you'll get a little inflammation around a suture, but that's actually in some ways an implant, right? But with the buccal fat pad, reduction, removal, you're just making a little hole, and we're talking about far less than an inch, maybe half an inch, roughly. And you're removing that fat. And then another thing too is, it's sort of anatomic, is that it's in the upper part of the mouth, so you don't have pooling of saliva over that incision, which would potentially seep into it. Whereas the chin implant, for all the sort of opposite reasons, it's a little bit, in my opinion, problematic to come in through the mouth. One is it's in the lower part of the mouth where saliva will pool over those over the incision, potentially seep through if it's not closed absolutely perfectly. And then again, it's an implant. So if you get bacteria on an implant, even in the face where it's immunologically privileged, where you're much less likely to get infection, you can in fact get an infection. But the real reason I don't like to go through the mouth is that, again, it's all about providing support, right? And so the lower lip, in a youthful individual should, in repose, meaning sort of like in a natural appearance, should almost totally eclipse the lower teeth, so you don't see the lower teeth. And as we age and we lose volume and bony stock and some of the strength in our soft tissues, our lower lip starts it starts to descend and reveal some of those teeth. Well, if you go in through the mouth, you can disrupt some of the natural sling-like structures, the muscles and some of the ligaments that hold the upper lip up, the lower lip up, and you can make the mouth look prematurely aged because you're releasing some of those slings. Then you're putting this implant in that is going to kind of work against that support and push those soft tissues down. Whereas if you go in through the submental region and you dissect those tissues and you put something underneath there, it's like a breast implant. You're getting some lift from that, and you're actually reducing some of that tendency of the lip to sink down with age. And that's the reason. That's actually the primary reason, and it's not as much of infection as it is that whole idea of support. I do tell patients that every once in a while, I do tell them, and I've not had to do it, but I just tell them conceptually, I may need to make a very small incision if I can't do the section as well, but I would do that in the midline, very small. I wouldn't disrupt the muscles that really provide that support to the lower lip. So again, I've not had to do it, but there may be a patient in which I have to do that, but it's totally different than making a big incision to put that implant in.
Gilbert, as we're wrapping up here, any more comments you would want to say in terms of combination of filler after somebody's had some of these procedures done?
Well, to Dr. Weinfeld's point earlier, and to your point, sometimes with the facial fat grafting, you do lose a little bit of that volume. So that'd be a great place for a filler to kind of, for lack of a better word, fill in the gap.
Yeah.
And so, yeah, I think that's a great place for it. Something that we kind of alluded to earlier is just taking this like pan facial approach at making sure that we address the patient from like holistically, and just kind of looking at their face as a whole, making sure that everything, as Dr. Weinfeld put it, is in harmony. Profile balancing, which is a topic we've talked about in the past as well. But I think that those are all very important aspects to getting the patient to a really great place.
Perfect. And then I typically will make people wait, and sometimes people will have a procedure done elsewhere and then come back because they want to touch up other areas. Do you have a time that you would make somebody wait to get filler in that area? Because I guess for me, once the capsule and everything forms around that, I feel like it's pretty good. But I don't like doing filler stuff right around a fresh implant unless it's been there for at least a few months. Do either of you have a thought on that?
Dr. Weinfeld on that. I'm not sure. I would arbitrarily throw out a number of like 6 months.
Yeah, I think that's very reasonable. Otherwise it's a moving target, and you're going to be, it just may be differential swelling that's creating this impression that there's a concavity or a dent somewhere. So yeah, I like that idea. I don't think you could create a problem by doing it earlier, but you just may be wasting someone's money. If they come in and they're like, well, I don't like this, and we're like, well, we don't know what this is yet. So give it a little bit of time before you throw money at this. Not that we don't want the patients to get fillers, but like you're trying to be wise and have a happy patient. Yeah,
happy and healthy and safe and all those things. And I think just one last note is I think it's super important for patients to be very open and upfront about having had past procedures like implants done, because that can certainly make a difference and play a role in how we address it from an injectable perspective.
Yeah,
that's a great point.
But yeah, fillers plus an implant, I've never seen there be a problem. I think it's a really nice way to go to finish things off.
Any last take-home points you'd like people to know about buccal fat pad, filler, chin augmentation before we go to our quote of the day?
I think we covered a lot.
I feel like we did.
Yeah, this is a good session.
Who wants to take the quote of the day?
I'll do it. I got one.
Oh, T-Bone's
got one
taking home,
on deck.
Okay.
From Zig Ziglar, the business guru. Fear has two meanings: forget everything and run, or face everything and rise. The choice is yours.
Wow! Boom. You brought it hard today. You were a little intense, huh?
You're welcome.
Okay.
You're welcome.
Yeah.
Rise up.
He got a new tat and his quotes got a little bit more intense. I like it.
That's right.
Well, thank you all for coming today. Appreciate it. Thank you all for listening. We appreciate you for letting us do what we love. Thanks for tuning in to Plastic Surgery Untold. Greatest podcast in the world is voted by us. Download us anywhere where you get your favorite podcast. And then don't forget, you can also watch us on YouTube. All right. See you guys. Bye.
Bye-bye.
Peace.